seminar in our series for fall 2011, hosted by the PRC and sponsored by the Youth and Family Endowment. We have Megan Conklin and Tiffany Menendez from the Dell Center for Healthy Living, Michael and Susan Dell Center for Healthy Living. Tiffany is the Assistant Director of the Dell Center for Healthy Living at the University of Texas School of Public Health in Austin. She is currently the Project Director of the Be Well Book Evaluation Study, Co-Project Director of the Texas Childhood Obesity Prevention Policy Evaluation Project, and Program Manager of Live Smart Texas, a statewide coalition of more than 90 organizations committed to improving the lives of Texans through obesity prevention. Megan is the Associate Project Director on the Dell Cash Middle School Grant and a Research Associate at the Dell Center. She oversees the implementation and evaluation of the Cash Middle School program across Central Texas. So, yeah, let's welcome our guest. Hi, everyone. Thanks for coming today. I didn't realize it was the first seminar of the semester, so thank you. All right, so we'll get started. So today we're going to split up the talk. I'm going to talk a little bit about our research center and then the project that Naomi just mentioned, the Be Well book. So the objectives of our talk are to understand and identify the key functions of the Michael and Susan Dell Center for Healthy Living, to understand the Be Well Book Club intervention and evaluation study, and to understand the cash components or resources and how they can be utilized to foster communication, and to identify critical aspects of preparation and coordination of a middle school social marketing campaign. Oh, and one more, to recognize the challenges faced and lessons learned in a social marketing program. So the Michael and Susan Dell Center for Healthy Living was established to conduct research to better understand and influence behaviors and environmental conditions that affect healthy living. We were established in 2006 from a grant from the Michael and Susan Dell Foundation, which is the family foundation of Michael and Susan Dell, and they're based in Austin, Texas. We're housed within the University of Texas Health Science Center, and it's based in Houston, but there's regional campuses across the state. And so the Center for Healthy Living is the home base or headquarters is in Austin, Texas. Recently, our center was awarded a $3.75 million grant to provide infrastructure and communication and a couple of other cores that I'm going to describe to you for 4 years. And our center is led under the direction of Dr. Deanna Helcher and then co-director Dr. Steve Kelder. The vision of our center is healthy children in a healthy world, and our mission is to serve as the state, national, and international leader in the promotion of healthy living for children and their families. You may have heard about our project CATCH. That's our core project, and it stands for the Coordinated Approach to Child Health. Oh, I'm sorry, I got ahead of myself. This is one of the objectives that you're supposed to hear. So our center key functions. Our key functions, which are part of our mission and vision, is to create new scholarly works that push the frontiers of public health science. So that's creating programs and interventions on child health. We also want to translate and communicate and disseminate evidence-based programs and practices from these scholarly works that we are researching. And then another core function is to train, educate, and to do community outreach within the Central Texas and the state region. So now I'm going to go through and just give you some quick numbers with our center. We have 24 faculty, and our faculty are based in Austin, Houston, and then we have 2 in San Antonio and 1 in Brownsville. We have 87 staff, that includes full-time and part-time staff, 2 postdoctoral students, 23 graduate assistants, which are master level students, and then 34 casual data collectors. And there are data collectors who go out in the field and do our measurement data collection for our project. And then we have 2 undergraduate assistants. So we have 56 research projects. That means that we have 27 that are past funded, but we're still doing analyses. So CATCH from the late 80s and early 90s, the original program, we're still working on that. We're still writing journals on those findings. And then other projects that are past funded, we're still doing analyses and putting out manuscripts on them. Of those, 30 are also active or currently funded, which Megan's going to talk about one, and then I'll talk about a few others. So I mentioned that we have 4 sites. And since September 1st of 2006, we've received $28.6 million in funding on grants. So those grants are related to anything in child health, mainly obesity prevention, but we also do a lot of research in tobacco and alcohol prevention. So now, our center core project is CATCH, which is the coordinated approach to child health. We have an elementary component of CATCH, which is the one that's most recognized. And we have an effort going on in Central Texas for 4 years. It recently ended about a year and a half or 2 years ago. And now we have a middle school grant going on in Central Texas, and Megan is going to talk about that. So she'll go into detail. And she'll also give you more background on CATCH too. So more of our research areas include all of these. We've recently done a lot of preschool health education. That's going into daycare centers, Head Start centers, to try to promote nutrition or physical activity. We do a lot of epidemiology studies in alcohol, tobacco, obesity, and environmental assessment. So a lot of our environmental assessment is about walkability or physical activity in communities. And then, like I said, we do international tobacco prevention. We have a lot of studies going on in India right now with their tobacco problems because they have such a high prevalence of tobacco there, or tobacco use. And then we also do a lot of policy impact evaluation, and we do that a lot for legislators in the state since we are in Austin. Before we were in Houston and we moved over in 2007, and since then we have been asked to do a lot of policy evaluation related to physical activity, the school health mandates, or their coordinated school health programs for the state. So it's been very interesting to get those questions asked from our legislators. Alcohol prevention, school-based research, that's what we're known for. Community-based research also. And then we're involved in the community, and we do a lot of events and programs for the state. So our faculty, this is a list of them. I just want to highlight a few of them. Our center is led by an executive committee of 5 members, and so it's Dr. Deanna Helcher and Steve Kelder, and then Dr. Cheryl Perry, Guy Parcell, and Dr. Bill Cole. Dr. Cheryl Perry and Guy Parcell, they were the lead researchers on the CATCH program, if you know any of that research, and then now Dr. Deanna Helcher and Steve Kelder lead CATCH. And then here's our staff. Our staff is broken up in different offices. So in Austin we have 2, and they're just a few blocks apart right now. But we have a Guadalupe office and then a Trinity office. So the Guadalupe office is for research and administration, and that's where I'm at. And then the Trinity office is for our field staff that do the intervention and evaluation, and that's where Megan is. And then we have a couple of people in Houston who do our data management. So our annual event, we have every year the Michael and Susan Dell Lectureship in Child Health, and it was established in 2006 when we got the funding from the foundation, and it's to recognize lead researchers who are making outstanding efforts in child health. So for example, our past recipients, you may recognize some of their names, are Dr. Mary Story, Dr. Bill Deese from CDC, Dr. Shariki Kumanika, Dr. Kelly Brunell, who's the lead researcher in soda tax, and then Dr. Russ Payne. This year our lectureship is in March, and we're bringing Dr. David Hawkins down. And if you're interested, there's our website for the event. Texas Obesity Awareness Week, that was established by the legislature in 2008, And so we as a center decided to take that on as an event that we want to host because that's what we do. We want to promote obesity awareness and try to prevent it for the state as well as the nation. And so we took that on, and what we've done since '08 is held an annual event, and it's declared the second week in September. So we just had it on September 13th, about a month ago, or a few weeks ago. And we have recognized state leaders, and so we award them with the Texas Health Champion Award, and it goes to members and communities that are in the state that are being active in the community to promote policies related to obesity prevention or just promoting healthy living. So this past year we had a woman from the Brownsville area awarded with this, and she's a master gardener. So she's doing all these great things in the valley, and she's promoting gardening. She's putting up gardens in the valley area. So very exciting to bring in these members to Austin. And Twitter. So he always says he's tweeting the deep, so you should follow him so you can hear more about what's going on in Austin. And this is just a summary of all of our media from May to August. So we had 46 stories published, and then the main was about expert opinions. So it could be calling up our director and asking her for feedback on the obesity prevalence for the state. That's just an example. There's a couple of things coming out in the next few weeks because we just received a large grant from CEC, so that'll be coming out in the media too. So the next thing I want to talk about is another new component with this center, which is the Dell Health Scholar Program. That's a pre-doctoral program that's new. So we accept 2 pre-doctoral students each academic year, and it's a competitive application process, and it'll open up this December to start September 1st, 2012. And this is a picture, just to give you a little bit of background. That's Dr. Steve Keller, and then Dr. Aliyah Husseini, who's our project director, and then Dr. Helter, the director, and then our 2 Dell Health scholars, Eileen and Melissa, and then on the right is Dr. Cheryl Perry, who's our regional dean. So the Dell Health Scholar, it includes your salary, and then you can go to 2 conferences a year. And what you're doing during this program is you're working on analyses with faculty members, which gives you a lot of opportunity to publish and then to present. So if you're interested, I can give you more information about that. Now we also do a postdoc program. So there's a typo, it's a full-time position for a year. And it's also a salary-based position, and then doing data analyses and then working on grants. The next thing I want to talk about is our Community Advisory Board. So we have 6 community members in the Austin area who consist of our advisory board. And so they're helping us make sure that we're in the community doing the right things related to child health to promote healthy living. So we have a youth minister on the board, and then we have school leaders and community members. And right now we're launching a youth leadership grant application for middle schools, so they can apply and get a small award from this community advisory board. And then we'll also publish a newsletter. So the last thing on the center that I want to go over is we're going to be publishing a theme journal supplement, and our target book date is 2013. So it's going to be on child health, and it's going to be all articles from our researchers, and then we're going to be asking for guest editors across the nation. And this journal is going to be based on our rainbow is what we call it, but it's just a framework of child health that includes all factors related to child health, so cultural, families here, and then policy related, but all of those encompass our model. So that's the center in a nutshell. So now I'm going to move on to the Be Well book, which we presented yesterday at the Southern Obesity Summit. So ways to be well. So first things that come to mind are eating well, being active. What about starting a book club? So we started a one-month book club in Austin last November with moms in a low-income urban area. And I'm going to describe the experience that we had and the results that we had. The book that we used for our book club is called Be Well, Messages from Moms on Living Healthier Lives. And I don't have copies of the book, but I did bring flyers that kind of describe it. But this book is a book of role model stories developed by the Michael and Susan Dell Foundation and the Alliance for a Healthier Generation. And it showcases 15 moms across the U.S. And those moms are also urban moms who are trying to develop healthier ways to lead their family, but also on a low-income budget. And the book is unique because it addresses 5 behaviors that we all know improves health. So it's increased intake of fruit and veggies, increased physical activity, decreased screen time, decreased junk food intake, decreased sugar-sweetened beverages. And then there's the website. They're currently out of the books, but you can download a PDF copy of the book from that website. So just a little bit of background on book club use and health promotion. So role modeling through peer stories has been used in behaviorally based research for many different behaviors. So some research shows that mothers can be targeted through peer stories are effective because moms do play a role in their children's lives. Other research shows that people often open up and share more when they're in a small group setting. And then personal stories and narratives can be used as a way to illustrate these between each other's experience. So we received a very small grant from the foundation to evaluate the book because the foundation wants to know what should they use this book for. So the purpose of our evaluation was to develop a 3-part evaluation series to determine the effect of the book on increased awareness and intentions to change behaviors related to healthier living. Our evaluation included both quantitative and qualitative data collection and then the book club intervention that we developed. And today I'm only going to talk about the book club intervention. So we hypothesized those who read the book showed changes. So they had increased awareness, intention, and self-efficacy of those 5 behaviors that I just talked about. So real briefly, our methods. The pilot intervention was conducted in Austin. We recruited 4 schools, 2 were control and 2 intervention. Our target population was low-income moms and English and Spanish speaking. And then, like I said, we did focus groups, and then we did a pre- and post-test survey. So the survey is based on our other studies, so from Spain and CATS, and it's a health behavior questionnaire that assesses physical activity, nutrition, screen time, and then we also added newly developed questions on the book to determine the impact of it. So our recruitment efforts, we got 54 parents, and I just want to remind you, it was a pilot study. 33 were control, and 21 were the intervention book club parents. So the control, what we did is we met with them, and we gave them the book, and we gave them the pre-test. And we said, we'll be back in 4 weeks. We're going to give you the post-test and a focus group. And we said, if you come back, we'll give you a gift card. Well, the intervention, we go and give them the book, and we give them the pre-test, and then we give them a schedule of stories to read. So we read a couple with them on that first day, and then we met with them for 4 weeks, once a week during that 4-week period. And we went through the 5 stories, 2 or 3 to 5 stories a week, and we let these moms lead the group discussion. They loved it. They loved talking about the moms in the book because those moms they could relate to. Because they're normal, everyday moms. The pictures in the book show them they look normal. They're not intimidated by them. And so that's how we led that book club session. So our demographics, we were largely Hispanic, and that's what we wanted. 65% spoke Spanish. So we had 2 of them were Spanish speaking only, and one of our staff members led those, and then the other 2 were English speaking. Most of our subjects didn't complete high school, and then over 3/4 received government assistance. So what we found is that our intervention group found it easier and more enjoyable to make the changes once they read the book. They found it very inspirational. They, like I said, they loved the book. And then the book club participants indicated that they wanted to keep the book club going. They didn't want us to leave on that last day. They loved it, like I said. They wanted to keep it going. They would go home and they would talk to their moms, they would talk to their sisters, and they wanted to start their own book club. But they did want more information, so they wanted recipes from the book. They wanted to learn about portion size models or how to control portion size, and then they also wanted cooking size. So a little bit more results. The English-speaking subjects found it easier to make diet-related changes, but the Spanish subjects were better at making physical activity changes. So a few more results. So our intervention or book club read an average of 13 stories, and that was because we were facilitating and we met with them weekly. They showed significant improvements with increased food barriers, a decrease in sugar sweetened beverage consumption, increase in physical activity, decrease in the junk food, and these are all hitting the book target. An increase in whole grain serving knowledge, and then increase in physical activity knowledge. Our control group, they read an average of 6 stories. They showed significant improvements in decreasing sugar-sweetened cereals, but they increased their fruit serving knowledge. Both groups, they strongly agreed they would use the book again, and they reported positive outcomes. And this one's kind of interesting. Some found nutrition tips more useful than the physical activity and the screen time tips. So what we learned, I didn't mention this much, but well, I'll go into that in a minute. But more quantitative data and a larger sample size is needed. Like I said, it was a pilot study, so we do need a larger sample size to show more changes. But this was very feasible. It was so easy to do, and it was inexpensive, and it's what this low-income population needs to provide education on healthier living. And then, since it was only a 4-week book club, it could have limited our results. So I just wanted to read a few quotes from our focus groups that we found interesting. So here's one. The stories catch your attention. As a mom, you want to do the right thing for your kids. The book is inspiring. We are an obese nation, and our children are not healthy. This book hits on an important topic. The book covered a lot of different people and represent many different ethnic groups. I love that. And then you get motivated to give it your best and to educate your children about making healthy choices. So, as you can tell, they loved the book, and they found it very inspirational, and they mostly liked it that it was normal women in the book. So here's a couple of photos. Our moms were really fun. The average age was probably 35, but then we had one grandmother who's raising her grandson. And this is just a certificate that we gave to them at the end of the book club. So, it's easy to start a book club for health promotion. So, you invite the interested moms or parents to participate in a weekly book club. And then you get the details, the location, the time. And then you set the book reading story. The moms that we worked with, they appreciated that schedule because it kept them on track. And then you just go and you share your thoughts. You try not to lead the book club yourself, but let the community members or moms lead it so that they're sharing their own thoughts and perceptions. So our conclusions, this is what I was mentioning earlier. I didn't talk much about our national evaluation, but we did have a national survey go out nationwide, and it was the same survey as the book club and control group. But it was just hard because we weren't there in person, obviously, and we weren't there to ensure that they read the book. So it is easier to do it in person. The book is best used in an interactive setting like our book club, and then it's very inexpensive, and it's an easy way to disseminate health education material. So future directions we'd like to see with our study is to consider expanding it to improve our sample size, to add this book club activity as an adjunct to another study. So we're going to do that with a new grant we just received. It's a community-based grant on obesity prevention, but we're going to use the book as a small intervention tool with the community members. So that'll be exciting to continue. Ways to disseminate the book. We got feedback that the moms thought we could disseminate it at workshops or conferences, so they were thinking at libraries or community health fairs. And then we also recommend the longer book club session that includes cooking classes, more information on nutrition, food labels, and then more discussion on the stories. And then I just would like to recognize this study was funded by the Michael and Susan Dell Foundation, and I just want to thank those who helped recruit the participants. That wraps me up. This is my contact information for the center if you're interested, and I can answer questions once Megan's done.
Tiffany, we are now going to do an activity break. Stephanie mentioned at the Michael and Susan Dell Center for Healthy Living, one of our things is to promote physical activity. I've already lost somebody. We're going to back. We're going to back up. So we're going to do what we call an activity break, and this is something that we promote and encourage with the classroom teachers that are involved in the CATCH program at the schools that we work with in Central Texas. So it's a short bout of physical activity to be done in the classroom. So all of y'all would stand up for me, please. Very simple. Also kind of a way to assess the knowledge that you just gained from Stephanie. So this is called true or false. I'm going to make a series of several statements, and if you think the answer is true, you're going to jump up and down. If you think the answer is false, you're going to squat. Any questions? Let's see everybody jumping up and down. All right, we got that. Let's see everybody squat. Okay. All right, nice big squat. We are low. All right. So I'm going to make statements. If you think it's false, you think it's true, you're jumping up and down. If you think it's false, you're going to squat. All right. One of the main focuses of the research for the Michael and Susan Dell Center for Healthy Living is for adult health issues. Yeah. What's the main focus?
Children.
Yes, child mental health. Very good. All right. The Be Well book captured messages from dads on how to lead a healthier life. Okay, who is the main focus? Who is moms? All right. The CATCH program stands for Coordinated Approach to Child Health. Very nice, very nice. You guys are doing really well. Tiffany is the best presenter you've ever seen. There you go. All right, and we can have a seat now. I think I got you back. Just wanted to do a quick activity break, have a little fun, and then highlight some of the things that we encourage the teachers to do with the CATCH schools that we work with. So I'm going to highlight CATCH, and I'm going to specifically focus on the Central Texas Middle School project, but I'm going to kind of start larger and give you an idea of CATCH and the programs that we have, and then kind of funnel down and talk specifically about the CATCH Middle School program and highlight our social marketing campaigns that we developed. So first and foremost, CATCH is a coordinated school health program, and in the state of Texas, the Texas Education Agency, they stated that there were four for middle school. They basically said there are 4 programs that they backed in the state of Texas, one of which was CATCH. So if you're middle school in Texas, then it was mandated that you select a program, be trained in the program, and then implement a coordinated school health program, and CATCH was one of the TEA approved programs. So coordinated school health is based on the CDC 8-component coordinated school health model, and it's basically a process process which brings the school community together to create healthy kids for a lifetime. And then CATCH, Coordinated Approach to Child Health, is a multi-component program. So it's to be implemented campus-wide, and it's a fun and doable coordinated school health program. So Tiffany mentioned this a little bit earlier, but just wanted to highlight some of the research from CATCH, which dates back to the early 90s. And if you'll notice, it was conducted in 4 geographical areas: California, Louisiana, Minnesota, and Texas. So for Louisiana, it was actually here at 200 Public Health. And there are over 5,000 students represented in nearly 100 schools. And so basically what we found after that 3-year trial is that students had reduced total fat and saturated fat content of lunches, increased moderate to vigorous physical activity in PE classes, improved students' self-reported eating and physical activity behaviors, and the effects persisted over 3 years without intervention. So we received another grant to basically track those students that went through from 91 to 94, and those effects persisted over 3 years. And then we've also had a lot of positive effects in the El Paso area within Texas. So these are the 4 programs that we have in CATCH. And as Tiffany mentioned, the CATCH Elementary program is probably one of the kind of most nationally recognized. The middle school program, we just developed that about 2 or 3 years ago. The early childhood program, we developed that within the past 2 years. And then the CATCH after-school program, CATCH Kids Club, is another one that is born out as well. So we have 4 different programs, and we're talking about high school. We haven't gotten there yet, but. So, as I mentioned, I'm going to talk specifically about the CATCH Middle School project. And so we work with 39 middle schools within 5 school districts in Central Texas. So that's about 30,000 middle school students. And our specific goal is to decrease the prevalence of childhood obesity among 8th graders within those 5 school districts from 17% to 11% after 3.5 years of the grant. So we have 1 year left in the grant, so we're 2.5 years in. But, anyway, when we did our baseline, what we found was that it wasn't 17%, it was actually 19.2% of the 8th graders within those 5 school districts were obese. So we actually had to go from 19.2% to 11, not 17 to 11%. And so if you'll notice, the Central Texas 8th graders are above the national average for obesity and overweight. And that was the goal for 2010. So we're slightly above that. So I'm now going to go into the CATCH components to kind of give you an overview of what the CATCH program looks like. So you'll see we have a classroom curriculum for the classroom teachers. We also have an activity box for the physical educators. And then we have a family component where we provide newsletters and resources for parents who come into the school community. And then we also have resources for school food service so that they can highlight the healthy menu items, prepare, plan, purchase, and promote healthy items to students. And we also had activity breaks, which you guys just did one of those, which again we promote those for the classroom teachers. And then we have a CATCH champion and a CATCH team at each campus. So the CATCH champion is the cheerleader for the campus. They make sure that CATCH is happening at the campus, that physical activity and healthy eating is promoted. And then they receive support from the CATCH team because it's not a coordinated approach if one person is doing everything. So the CATCH team mobilizes the entire campus. So the idea is that everybody on campus is doing something to promote health and wellness within their classroom, their cafeteria, the office, etc., wherever they may work. And then what brings all of this together is a CATCH coordination toolkit, which we just developed in the past couple of years. And that's what this is up here, and I encourage you guys to come look at this. So the toolkit is a roadmap for implementing CATCH on your campus. So it's divided into six weeks, and every 6 weeks, every staff member on campus has 3 tasks that they can do to promote coordinated school health and specifically CATCH. So what we found was that a lot of the teachers were excited about CATCH, but they want to know, what can I do? Give me something tangible that I can do. So we created this toolkit which fosters communication and coordination as all of the areas are doing the same type of thing each 6 weeks to promote physical activity and nutrition on the campus. So it truly is a campus-wide effort, not just the PE teachers and not just the food service workers trying to implement healthy eating and physical activity. So these are the program materials for the Catch Middle School program. So these have a little thing in it. I don't press any buttons, so I don't know where they're going to take me. But these are the resources up top. This is what you'll find in the coordination toolkit. So these are the folders for each area on the campus. So there's a folder for administration, there's a folder for special ed and support staff to include custodians, secretary, folder for classroom teachers, etc. And then down here we have specific resources. This is the Eat Smart manual for food, child nutrition services. These are the activity boxes I mentioned for PE teachers, and this is the classroom curriculum that I mentioned for the classroom teachers. So some of the areas have more resources than others, but everyone receives one of the coordination folders to help them implement Catch in their specific area. So as I mentioned before, each campus has a Catch champion, and then there's a Catch team that mobilizes the school, and then everybody is involved in carrying out the implementation of Catch, because as I mentioned, everyone has a role, and each 6 weeks they actually have 3 tasks. So I want to tell you a little bit about our evaluation design for the Catch Middle School project in Central Texas. And so it's a basic, enhanced, and enhanced plus, but I'm going to call the basic level 1, enhanced level 2, and enhanced plus level 3. So our level 1 schools, we have 19 schools that fall in that category, and they receive Catch training and resources. The level 2 schools, we have 10 schools that fall in that category. They receive training, resources, and a facilitator, which is someone like myself, to come into the schools and help them implement Catch. Level 3 receives all of that, plus the social marketing campaigns, which I'm getting ready to talk to y'all about. And then 10 schools that are in that level 3 position. So what is social marketing? It's very basic. It utilizes commercial marketing strategies to bring about voluntary behavior change. Targets a specific audience. For us, it's middle school students in Central Texas. Promotes the social good. And I'm going to walk you guys through the planning, implementation, and evaluation of our 2 social marketing campaigns, Get Your 60 and Get Your H2O. So Get Your 60, the goal there was to increase student physical activity to meet the recommended 60 minutes of physical activity every day. Get Your H2O was to increase student tap water consumption. By doing that, decrease sugar-sweetened beverage intake. So I'm going to start off with talking about Get Your 60, which again is promoting the CDC recommended 60 minutes of physical activity every day. So why Get Your 60? This should just kind of highlight some of the formative research that we did to arrive at Get Your 60. And fortunately, the VERB campaign had done a lot of research for us, so we were able to utilize that. But we also had focus groups and surveys with the champions and with the students to form the campaign. So these are all of the Get Your 60 components, and I actually brought all of this stuff with me. So what we did is we asked PE teachers, could you open up the gym before school starts and invite students to come in and be active? Because what we found is students were getting to school early, and they were either just standing outside because they couldn't come into school yet, or if they got there early, they had to go into the cafeteria and sit. So we thought, can we restructure that and incorporate more physical activity into the school day? And we asked PE teachers to do that 1 day a week. That was our limit. We said, let's just start with 1 day. The other thing that we did is we worked with the community to get community organizations involved that offer physical activity. Because we not only wanted students to be active at school, but also with their families within the community. So we called several different organizations within the Austin and Central Texas area, and they were all really excited to be a part of this. So what that means is we asked them to offer some sort of discount to these students, whether that be free access, buy one get one free, some sort of discounted service. And we were going for the family package. So not only for the students, but if they brought their family members, could they receive some sort of discount or service. The way they would receive that is by wearing their Get Your 60 wristband. That would get them access into the community park. And on the wristband, and I'll pass this around, it says swim, run, jump, bike, hike, climb, walk. And so the idea is that this would also be their visual cue to get their 60 minutes, and here are a variety of ways that you can get your 60 So they receive this, and within this packet, there are three information pieces. One is for the students. This was for the students explaining what the campaign was. We had one for the parents, and there was a Spanish insert in there. And then we also had a little card that they could use just in case they lost their receipt. So this would also get them access into the community partners. And then we had a website we have a website that highlights all the community partners, the deals that they offer, where they're located, that type of information. And then we also have prizes for students who were caught, I'll get you in just a minute, prizes for students who were caught being active and wearing their wristband. So if they were in the classroom and doing an activity break and they were wearing their wristband, they could receive a prize, or in PE class. So these are the various prizes. Up here we had a little bag, a little football, frisbee, a water bottle, and then we also had a t-shirt. So again, you guys can come up here and look at these. And these were the prizes, and again, we wanted to reward them for being active with equipment that they could continue to be active or drink water, etc. Yes, ma'am?
I don't know if you generally work in like a school district, so it would kind of all middle school kids in an area would be involved, but I wonder if any of the organizations opened up those accounts to all of the kids of a certain age, or something. It wasn't just like restricted to one school or students at school.
It was restricted to those that were in our 10 schools, the level 3, because it is a research project, and so we were trying to show basically the difference in the 3 levels. So, but what we would like to do is, once the grant ends, open it to all 39 middle schools in Central Texas, but for right now, we're focusing on the 10 level 3 schools. Good question. No. I don't think these things like me. Doing it on the computer, right? But there we go. So what is it? If you wanted to come up with kind of just a quick slogan, band up, get active, win big. So the band up again is wear the wristband that they receive when they come to open gym. Get active, which is being active at open gym and then also as a community partner. And then win big. So again, they won prizes for wearing their wristband and being active. And then also you win big by receiving these discounts from the community partners. This is just an example of our website, and again, I explained the information that students could find students and parents could find on the website. And then I wanted to highlight who our community partners were. So I didn't put the names, but I wanted you to see a variety of organizations that were represented. So we had bowling, we had archery, we had dance, we had YMCAs, we had rec centers. So we really tried to offer a wide variety of activities that all students would be interested in. And when coming to open gym, we asked the PE teachers to do the same and not just offer basketball or just volleyball, because then you're only going to get kids that are interested in those. We wanted to include the non-athletes and have everybody active at open gym. So now I'm going to show you some of our evaluation of open gym, and we utilize 2 methods. One is SOFIT observations, and that's just a tool used to measure moderate to vigorous physical activity time. And so we had 2 data collectors that went into 6 schools to assess attendance, moderate to vigorous physical activity, student and teacher involvement. And then the open gym coordinator, which sometimes that wasn't always the PE teacher, sometimes it was the catch champion. We interviewed them as well to assess their open gym schedule, who staffed it, etc. Because we just said, do this, go, but then our evaluation team went in to see exactly what that looked like. So if you'll notice, we were able to do SOFIT measurements and open gym coordinator interviews with 6 of the 10 schools. And the frequency ranged anywhere from 1 to 5. And as I mentioned earlier, we only asked these teachers to open the gym 1 day a week, and they went above and beyond the call of duty and offered it a lot more than that because students were so excited about the opportunity to be active before school started. The moderate to vigorous physical activity minutes ranged from 7.8 to 31.7. But keeping in mind, some of them only had it open for 15 minutes, and some of them had it open for 30 or 35. So the attendance ranged from 23 to 155, and these were primarily done in the gym setting. The one that has the S by it means that it was structured, and the only option that they had was to walk around the track. And then the asterisk indicates schools where they had specific grade levels on certain days. The 6th and 7th graders could come Tuesday, Thursday, 8th graders could come Wednesday, Friday. So what do you notice about the percentage of boys? Not a trick question. What do you think? High, yes, so it's very high. So we've struggled with getting girls to come to open gym. And we've offered music and we've offered dance, and they're just not coming. So I asked for some ideas of the presentation, and they suggested, having a day just for girls to attend open gym. So we're going to look into that. And then this is a really cool chart too, because it highlights the percent of time that students were engaged in moderate to vigorous physical activity in open gym. And our goal with CATCH is 50% moderate to vigorous physical activity. And if you'll see, all of these schools exceeded that, some of them getting upwards of 80% moderate to vigorous physical activity time. So that's really impressive. That's very hard to achieve. So these are some of the barriers that we came across was space. So a lot of these gyms are used for athletics to practice in the morning. Fortunately, a lot of the Texas schools in Central Texas have a big gym and a small gym, but sometimes they were both being used, so then the track was utilized. Attendance had to be capped at several of them due to gym size, so we actually had to turn kids away, or the PE teachers had to turn kids away because of the demand. The staffing, again, PE teachers, a lot of them are coaches, and they had to coach in the morning, so figuring out who was going to staff open gym was difficult for some of our schools. Administrator support, at first, some of the administrators weren't so sure about this because they were worried about safety, etc. But once we started the program, all the administrators were on board because it cut down on students in certain other stations. They came to class more ready to learn, etc. And then low female attendance, which you guys pointed out. So here's the teacher response. So this is as reported by the Open Gym Coordinator. They said students came to class ready to learn. Ready to go. Students are calmer. It's fun to supervise open gym. Kids get a lot of energy out before school, and it lightens the teacher's load at the other duty stations. They have the access, and if the environment is conducive, they actually may, engage in physical activity and enjoy it. So these are some of our lessons learned from Get Your 60. Obtain district support. We work with 5 districts. It was really important to work with the district leaders and get them on board and get their help in making sure that the programs were up and running within the campuses. Having a principal assigned duty station. So in other words, a lot of teachers have cafeteria duty in the morning, or they have bus duty. Making open gym one of the duty stations so that it's part of the infrastructure of the school and it's sustainable. Organize the play area by equipment ready zones. So in other words, have the equipment set out. So, this half is going to be volleyball, the other half is going to be jumping rope and basketball, whatever. Organized by grade level. A lot of the administrators did not want to have 6th, 7th, and 8th graders in there all at one time. So as I mentioned before, they had 6th, 7th on one grade day and 8th grade on the other day, and that seemed to work out really well. One of the things, too, was that they